To hear the full episode, become a patron at patreon.com/deathpanelpod.
Welcome to the Death Panel. Patrons, thank you so much for supporting the show. We couldn't do any of this work without you. To support the show and get access to the second weekly bonus episode, as well as the entire back catalog of bonus episodes, become a patron at patreon.com/deathpanelpod. And to help us out a little more, share the show with your friends, post about your favorite episodes, hold reading or discussion groups, pick up copies of Health Communism and A Short History of Transmisogyny at your local bookstore or request them at your local library, and follow us at deathpanel_. I'm Beatrice Bolton, and today I'm really excited to be joined by two guests, China Mills and John Pring, to talk about the Deaths by Welfare Project, which tracks the brutal welfare system in the United Kingdom and how it kills people. First, we have China. China Mills is the head of research at Healing Justice London, lead of the Deaths by Welfare Project, and is part of the Stigma-Free Futures design team at the Joseph Rowntree Foundation. She has been published widely and is the author of the 2014 book, Decolonizing Global Mental Health, which is part of the Routledge Concepts for Critical Psychology series. China, welcome to the Death Panel.
Thank you so much. It's such a pleasure to be here.
Such a pleasure to have you. And next we have John. John Pring is founder and editor of the news agency Disability News Service, co-creator of the Deaths by Welfare Timeline, and co-editor and specialist advisor on the Museum of Austerity project. He's also the author of several books, including his latest, just published by Pluto, called The Department: How a Violent Government Bureaucracy Killed Hundreds and Hid the Evidence. John, welcome to the Death Panel.
Thank you very much.
Thank you both so much for coming on the show today. I have been a fan of this project since it launched, and I'm really excited to have you both on to talk about it, as upsetting as this topic can be. As I mentioned at the top, today we're talking about a project out of the UK called Deaths by Welfare, which documents welfare state violence by centering the resistance of people with lived experience of the welfare system and the strategies of bereaved families and comrades in fighting for justice against austerity-fueled state abandonment. It is a devastating and important project that China and John have been working on together since 2001 that pieces together the chronology of evidence around welfare reform in the UK and traces the strategies used over time by the UK's Department of Work and Pensions, known as DWP, to both forward welfare reform and to avoid accountability for the harm these reforms have caused. But it also tracks the resistance that has emerged against the state's organized abandonment. And of course, it documents only a small fraction of the deaths that have occurred as a result of the state's welfare reform actions and the rhetoric which has fueled it. So to start us off, China and John, for listeners who are not familiar, can you each briefly speak about your work and how that informs your approach to this project? And can you talk about what the Deaths by Welfare Project is and how you both came to be collaborating on it?
Sure. And thank you I think your summary of it was brilliant, Beatrice. I really appreciate that. Yeah, I suppose as a quick background, I had been working as an academic for quite a long time and now consider myself to be a recovering academic, having joyfully left. And part of the research that I was doing was around, I suppose, state and like the harms produced by the state and by big corporations, and particularly how that created the conditions that made like unlivable conditions that linked to people's suicides. And I'd looked at that in a number of different contexts, but one of those was the context in which I was living, which was in austerity Britain. And so I'm talking about the policies introduced kind of under the guise of austerity, sort of 2007, 2008 onwards, even though for sure some groups of people in the UK have lived a lot longer than that under austerity-like conditions. I'm thinking particularly racialized people. But yeah, the policies introduced specifically called austerity around that time. And before kind of working on that as sort of a research area, I'd been involved in a lot of anti-austerity activism and campaigning, and particularly of disabled people's activism against the introduction of what was called the Welfare Reform Bill and the kind of big changes to the way that welfare was administered in the UK, which maybe we'll go into a bit later. And being in those spaces of disabled people's activism, which were I should, I think it's really important to emphasize just how incredible disabled people's resistance has been to austerity and welfare reform, and just how fierce and creative and joyful, despite the horrendous nature of it, a lot of that activism has been, was really important to me. And it was for sure disabled people that were telling us first, and I think have been for the longest, how horrendous these policies were, and that they were causing people to die. And so it was that context and me kind of thinking, wait, there I am actually a researcher, like maybe I could kind of bring some of these skills to this and be of use, I suppose, that led to the early iteration of the Deaths by Welfare project. And I should say that was really made possible partly by me leaving academia and doing the project from and with Healing Justice London, which is a very different kind of beautiful space, a space where health and healing are seen as critical for collective liberation, a space that argues and creates for freedom from all kinds of violence, intimate, intergenerational, interpersonal, and really gave me the freedom to shape the Deaths by Welfare project with the people I wanted to, in a way that would resource those people and in the kinds of ways that we wanted to do it. And so it was in 2021 that I first reached out to John. And I always say very nervously, because I'm such a fan of Disability News Service, because they've just been so essential in really the main voice in covering the kind of violence that we were seeing, especially for disabled people through austerity. And since then, we have crafted the project and our timeline, which maybe we'll talk a bit more about together. But maybe John, you'd like to come in here.
Yeah. So I'm editor of Disability News Service. It's a news agency that unsurprisingly specialises in disability-related news stories. I've been running it for about 15 years, more than 15 years now. And for much of that time, I've been investigating the hundreds and probably thousands of deaths associated with the actions of the government department, the Department for Work and Pensions in the UK, DWP. And my book on as you said, the book on those deaths was published in August. And yeah, and then China got in touch early in 2021, and it gave me the project. I'm feeling I was thinking about sketching a kind of timeline on my own, and her getting in touch was just absolutely so important to me, giving me the kick to go ahead and write the book, because the book is actually a kind of timeline itself, and the timeline kind of structure to it, I think, has proved so important in showing and just highlighting so clearly how these deaths were caused by what, again, China introduced me to this concept of slow violence, slow bureaucratic violence. And you can see that through the timeline. It just shows it so clearly, dating back 30, 40, 50 years, how that violence has gradually increased, I guess, beneath the radar. And then suddenly it kind of exploded into awful violence in kind of 2010, 2011, 2012, 2013, 2014, those years where it was really worst.
So I'd love to just start us off here by talking about the project itself in a little bit more depth. So let's talk about sort of what it's become structurally, how folks can access it and what it is, but also what we mean when we say that welfare reform in the UK has caused a tremendous amount of death. Because over the years, I've lost several comrades to work reassessments and to difficult decisions they've had to make over how they're going to use their benefit money after they've been limited. And it's I think, really important to just spend some time sort of just setting up what y'all are documenting, but also what we mean when we say that the welfare system in the UK is, let's say, uniquely efficient at killing people.
Yeah.
Yeah. So I suppose because John and I, in different ways, had been so connected to disabled people's kind of movements and organising around the harms of austerity, I had heard from a number of folks in those kinds of spaces about the need for something like a timeline, right, or a database, or whatever we want to call it, an archive even, of really kind of pulling together the evidence, I suppose, that shows the ways that policies and practices that the Department for Work and Pensions were introducing in terms of welfare, how they were causing harm, like cumulative harm, so the buildup of harm for a lot of people, and also how they were linking to people's deaths. And I think one of the reasons that was so needed is that the Department for Work and Pensions, when kind of confronted with that evidence over the years, have often had a really stock response that's sort of something like, we take the death of benefits claimants seriously, but we don't accept the argument of those who seek to politicise people's deaths by linking them to welfare policy. They would say that was an inaccurate link. And often, spokespeople for the government would sort of say you can't assume cause and effect in that way. It's too complex. And it is complex, right? And as we wanted to kind of bring together that evidence as a tool in a way to speak to that, but I think also to really centre and honour how important disabled people's activism and resistance has been all the way through this. Mm-hmm. So it is about documenting harms, but it kind of is, it's also more than that, I think. And I think sometimes, I often describe working on the project as actually really joyful. And I think that can sound really weird given what it kind of focuses on. But actually, centering that resistance has been super important to the project. And I suppose why that came about was because it was disabled people that were really noticing people's deaths, right? So after the government introduced this kind of Welfare Reform Act in 2007, and we started to see some of these changes in terms of how disability benefits were assessed and some of the things you were just talking about, full of these ideas of like undeservingness and just ridiculous stuff about benefit fraud and this whole like cover story essentially to get public consent for these policies. It was then that we started to see that disabled people were dying, and we started to see coroner's reports that actually named the Department for Work and Pensions particular policies as being a trigger in people's suicides. Welfare advisors started to talk publicly about the people that they support and their sort of clients dying. Disabled people's groups started memorial websites with lists of the names of people who had died. I'm thinking like Callum's List, for example, or Black Triangle Campaign. And people would protest holding banners that were stitched with the names and the photos of some of the folks who had died. And also families started speaking out. And so you'd get the kind of odd, disconnected little article in local press that would talk to families, and often families were really, they were saying how much welfare policy or specific things about it had led to their loved one's death. I mean, we even saw people's suicide notes blaming the government in the newspapers. And I think for us, it was like, how do we there's so much evidence, and a lot of it was some of it was genuinely hidden, and some of it I think still remains hidden. But some of it was hidden in plain sight. Like it is available online on like judiciary websites, or kind of hidden away in these prevention of future deaths reports that get written that are supposed to inform, making sure that there's change to prevent similar deaths happening in future. All of these things are online, but you almost have to know that they're there to be able to find them. And so we wanted to bring all of those pieces of evidence together to really document, I suppose, in what we've called a timeline, that bureaucratic sort of violence that or administrative violence that people were experiencing. And to do that in a timeline felt important because like we were talking about, we've been thinking about how this violence is quite often slow. It's not always like a spectacular violence. It's a slow violence where, policies get created and signed off in Whitehall in London, and then their effects can be lived and felt by people months or years away from that and miles in distance away from it. And so we wanted to create a kind of tool, I suppose, and I always think as a tool for disability justice in a way, that could track some of that and bring some of that evidence together.
Yeah. And I want to stress also that point China made there about it was disabled people who started this work first. And it really was, because I remember going to protests in kind of mid to late 2010, which was after the Conservative Liberal Democrat coalition came in and austerity really started to kick in 2010. And those protests in 2010, organizations actually started up about austerity, disabled people's organizations, Disabled People Against Cuts, Black Triangle. Black Triangle actually started because of a particular death in Scotland. Mm-hmm. And there was work by organizations like Spartacus, which was again a grassroots organization of disabled people, mainly working online together, producing brilliant research that showed that these deaths were happening and brought evidence together. And it took me like probably 3 years really to get a grip on what was happening and to realize that this was happening and it was serious and it was multiple people were dying, and to try and find a way to get that information from the DWP, from the Department of Work and Pensions. And they were hiding it for sure. And they are still hiding that information. I mean, you can have a look at the timeline. And one of the examples used when we launched it, I wrote an article. We used the timeline to show that DWP had been alerted more than 40 times to life-threatening systemic flaws in the disability benefit system over the past 30 years. And that those warnings could be linked to hundreds, probably thousands of suicides and other deaths as well. So, it didn't take long for the timeline to prove its worth, I think, and for China's, idea and her plan for it to prove its worth, I think.
Absolutely. And it's, it's enormous. It spans from, the early 40s through to, I think, late 2023. And this is a living document that's being constantly, or the idea, right, is for it to continue to live on and be updated as well. And one of the ways that this is useful also is it allows folks to do their own research and digging and to spend time with this history in a way that, for example, I can't think of any project in the US that could come close to this in terms of like documenting, for example, our system of low-income disability support known as SSI, right? Like there isn't anything like this I've ever seen before. And it's a really, really interesting kind of like form that this research has taken on. And John, you mentioned, the amount of times that the deaths connected to welfare reform have been brought to attention of the DWP before and their avoidance of it. Let's get into a little bit about what the DWP is and how the UK government has also prioritized anti-fraud measures and investigations into malingering and really aggressive surveillance of individual benefits claimants over acknowledgement of state violence.
Yeah, absolutely. And one of the key things to remember is that there's been wave after wave of these so-called reforms of the benefit systems over the last 30 years. And none of them have been aimed at making the system safer, more supportive or easier to navigate for people who need that social security safety net. All of them in their own way have been aimed at making it harder for disabled people to secure support. So they've reduced the levels of the benefits, they've tightened eligibility, they've toughened benefit sanctions. So they punish claimants who don't meet these strict conditions. So if you don't attend a work search meeting on time, if you're like 5 minutes late or something, you'll have some of your benefits docked, or forcing people to spend all their waking hours looking for jobs. I mean, 35 hours a week, but you have to provide proof of that. It's a huge organization, the DWP. It's got about 80,000 employees. It oversees both employment programs, pensions, disability support, out-of-work benefits. If you're poor and you want to survive, you have to depend on DWP. And I'm simplifying quite a lot here, but when it comes to disabled people, the two key benefits these days, anyway, are universal credit, which is an income-related benefit for those in work on low pay and also out of work. And there's also personal independence payment, which is for all disabled people who face kind of significant barriers in their daily lives. And you can be on high income and get that. Be at low income, it's not an income related benefit. It's supposed to contribute to the extra disability related costs that disabled people face. But for disability related support, there are always, I do please bear in mind, I'm simplifying quite a lot, but this is the basic thing. For disability related support, there are always assessments, and they are supposed to test the kind of functional nature of the barriers that the disabled person faces. And DWP, going back now to 1998, I think, the assessments have been outsourced to very large outsourcing companies. Atos is one of the big ones, a French company. Capita is another one in more recent years. Maximus, which is a US company, has done a lot of assessments in recent years. So these companies take on the assessments and they employ nurses, paramedics, etc., to carry out the assessments, either face to face or now sometimes over the phone or by video. And they give you a certain number of points, and then a DWP civil servant decides how much money you will receive, or maybe none. But because of the way that those, particularly the assessment systems, I think have been set up, the benefit systems have become, rather than the source of support, they've become a source of fear for many disabled people. And they become, DWPs become more interested in sanctions and strict conditions of control than support and advice. And got to a situation where the brown envelopes of the letters from DWP will arrive became, in the words of one disabled activist, paper symbols of state malice towards its claim. There's that kind of sense of dread.
To hear the full episode, become a patron at patreon.com/deathpanelpod. You'll get access to this and the rest of our catalogue of patron-only episodes, and be the first to get a new patron episode every Monday when it drops. With love, the Death Panel.